Hi, good afternoon. My name is Dr. Paul Zeitz, and I'm here for a live chat to talk to you about and answer any questions that you may have about the COVID-19 emergency that we're all living in right now. I'm happy to answer your questions as it relates to anything going on personally for you, within your family, questions that you may have about how to handle things, or how to seek medical care or medical services, or anything related to the public response from the government or from your employers or other issues or situations that you might be in. We're going to stay on today starting at 3 p.m. and we'll be available at 3 p.m. every day this week to answer your questions. So I'm going to start off with answering some of the questions that I've already received in advance, and from all the interactions that I've been having over the last several days to respond to people's questions. So one of the questions that many people are asking me is about how long is this going to last? Many of us have had an abrupt disruption of our life in the last week. We've gone from busy social beings interacting at work and with our families into this shelter-at-home mode, except for essential employees that are out there still doing some great work at the front line. So the truth is, I don't know how long this is going to last, but I think it's important to recognize at this point, I think we're clear that this is not going to end in a week or 2 weeks. This is something that's going to be going on for months from now. We see that epidemics in different parts of the world have different time frames, depending on the public health response and the control measures that are implemented. That will determine the amount of time that will be needed to respond to this epidemic. Before I continue, I would invite you to send questions into the chat on this live chat, and I'm going to do my best to answer them as they come in as well. I'd like to make this interactive with all of you, so feel free to put some questions in the live chat and we'll respond right away. So thank you for that, for those of you who are participating in that opportunity. I am concerned when I hear people talking about this as a 1 week or a 2 week thing, when in reality we know that this is going to go on for weeks, if not months. It's possible that the epidemic might continue even into 2021. So we have to think about this in this immediate phase and the medium term, and I think we have to think about how it's going to affect our lives in the long term. I know that's a hard message to hear, and a lot of people are still grappling with the disruption from this past week, but I would invite you to think medium term and long term as well as you try to sort out the information that is coming in and sort out your own lives. Let's consider this to be a longer term, several months into 2021 possibly as well. So the second question that I have received so far is our government response working? So governments around the world are grappling with this emergency that is spreading and growing at a volcanic rate, and every government is operating differently. And we in the United States, where I'm speaking to you from Bethesda, Maryland, we have different levels of government that are operating. We have the federal government, we have the state government, and we have our local county government. So the complexity of our system requires all these parts of government to work together in an organized, coordinated way. So at the federal level, they are implementing a whole of government approach. There's a whole of government coronavirus task force headed up by the Vice President, and he has brought together some leading experts, including Ambassador Deborah Birx, who is a colleague and friend of mine, who is the coordinator of that task force. Dr. Tony Fauci is a leading scientist from NIH, who's part of that task force. There are experts from FEMA, from CDC, from HHS, from State Department, across the whole United States government. So that mobilization is what needs to happen. The Treasury Department, et cetera, are all involved. Is the response working? I would say that the response has been very slow to get off the ground. There was a critical pause or delay in action during January and February that has left us behind the curve and in a difficult situation in trying to catch up. So at this point, though, we have to do whatever we can to support the federal government in implementing the best possible response. And that means including supporting the people that we know that are working in the response, bringing them ideas to how to succeed and to do better, and to also hold them accountable for bold and transformative action. We shouldn't sit by and expect them to figure it all out. We need to hold them accountable. State governments are operating at a much more steady clip because they're at the front line of the response. We see Governor Cuomo, Governor Newsom, Governor Hogan here in Maryland, who's the chair of the Governors Association. They're all mobilizing various interventions that focus on reducing the transmission, preparing the hospital system for the onslaught of people that require high-level medical care, and they're also all working to stabilize the economy in this unprecedented close down that we're experiencing. In my opinion, I think that they're going too slow. There are clear lessons from China, South Korea, and Singapore where there's an incremental approach to bringing in public health measures, the shelter-in-place orders, the stay-at-home orders, versus the countries that have done more abrupt or decisive or restrictive halting of person-to-person transmission. So in the countries that do more restrictive halting effort, the virus gets contained geographically and more rapidly. So I really want to salute the state of New York, the state of California, and Oregon, I believe, who have really implemented statewide shelter-in-place orders. I think that should be national. It should have been national last week, in my opinion. I think that what we'll see happening over this week and next week and the next month, as the epidemic is spreading rapidly in many parts of the United States, more and more sick people will be coming into the hospitals. You will see more and more restrictive and halting shelter-in-order efforts coming into place. So please prepare for that now, and please prepare for being in shelter-in-place for at least a month, if not longer. This is going to be an intense period of time, and right now, I would say for most places, this is the calm before the storm. We're already seeing epicenters of the epidemic in Seattle and in New York. New Orleans, Louisiana is also having a very rapid increase in hospitalizations. So that is just the beginning of that upsurge that will continue over the course of the next weeks. So I just want to invite you all again. I'm going to pause and please send your questions into the live chat. And I have colleagues and family members that are going to text that to me, and I'll be able to respond to that in real time. So I gave a bit of a long response about how the government is responding. I can talk more about what's going on in Congress or what's going on at the federal, state, or local level, if that would be helpful. What can everyone do to help is the next question that I've been getting. What can I do to help? How can I serve? That's been one of my major questions for myself. And so I've started by making sure that I'm staying healthy and that I'm staying grounded and that I'm working on my own mental health and my own dealing with it, my own anxiety and stress. So I think that's a really important thing that each of us can do is lead by example and lead by taking care of yourself and lead by implementing social distancing yourself in the ways that you can. It's challenging, and all of us are adapting to this very difficult situation. And then I think once you have sorted out yourself, I think really expand your circle of engagement to your family, and so make sure everyone in your family is receiving the care and support that they need. I've been on the phone for the last 5 or 6 days talking to people all over the country about how to go about determining shelter-in-place plans. Where to go, who to be with, how to manage social distancing during this kind of critical phase. So if we anticipate that there are going to be more restrictive, more halting guidelines about sheltering in place, then I think it's a good idea to start planning now and discussing with your family and your friends about how you're going to manage an extended multi-week, multi-month sheltering in place experience. The other thing that I'm discussing with my family is, what do we do if someone gets sick? If someone gets sick within the household, or if someone requires urgent medical care, how do we identify where to go for medical services? How do we make sure that people within the household are protected and safe? All these kinds of questions are important for there to be open conversation and open dialogue within your family. And then I've expanded that out into my faith community, into my friends and social network, and I'm offering support and sometimes just listening to people as they process and deal with this very difficult set of questions that each of us is facing. And so making yourself available as a form of service to people that you love or that you're connected with is an important way of coping with your own stress and anxiety. The other thing is talking to strangers, talking to people that you don't know. By me, for example, talking to all of you. Many of you I may know, but maybe I don't know all of you. Making sure your neighbors, if you live in an apartment building or in a complex where there's many people who you may or may not know, you certainly can reach out to those people as well. So I think also I would invite you to think about what action you can take to hold our government accountable for bold action. We've launched a campaign on Build a Movement 2020, focusing on protecting the people, testing the people, and treating the people. And you can learn more about that on www.bam2020.world. So the next question that I've gotten that I'd like to respond to is, what do I do if I start feeling symptoms? Which is something that is happening quite widely right now. Whenever there's this kind of health scare or epidemic scare, everyone starts wondering whether they themselves have been infected and they are also getting sick. So it's very important to keep track of your own health by doing regular temperature checks, by making sure that you're checking in with your family member to see that they're healthy, and also to see if you're showing any of the other common symptoms, which include coughing, dry cough usually, and or shortness of breath. There are some new media reports that came out today that some people are experiencing loss of smell, loss of taste as part of an early symptom scenario. I think I need to read more about that to make sure that is proven. That's the thing we're also all dealing with, is this flood of information that's coming at us. What's true, what's not true. So I'm doing my best. I'm working with my wife, Dr. Mindy Cohen, and colleagues around the country to process information. And so if you have specific questions, please feel free to email me through my website, drpaulzeitz.org, and I will send you the best resources that I can find. So in terms of what you should do if you are feeling sick, if you do have a fever or a cough or any of these early symptoms, it's very important that you isolate yourself within your family. If you're living with other people, please, it's strongly recommended that you find a space, a bedroom or another private space where you're isolated from the rest of the family. I think that's critically important, and particularly isolate yourself from elderly people or people that may be immunocompromised or at greater risk. In countries like China and South Korea, they have implemented a more aggressive approach where they've isolated people with symptoms or people with mild cases of coronavirus outside of the household. And that's something that I'm recommending to public health officials here in the United States that we set up a more aggressive isolation of mild cases or even asymptomatic cases that test positive. These folks should be put into a dormitory or a hotel for a limited period of time so that they stop transmitting even within their own family. So that is something that you can do yourself at this point, is self-isolate if you're showing any symptoms. You should also immediately contact your medical provider, your doctor. If you don't have one, please find one and reach out to a primary care doctor and get feedback on your symptoms. Your doctor, depending on where you are, may recommend that you go for a COVID test. Or you may be recommended to stay at home and stay in place. Now, if you are in a high-risk group, you should, like if you're elderly or if you have some kind of immunocompromised situation, or you're at risk, higher risk for COVID infection, pregnancy is another high-risk group, then you should be extremely vigilant about symptoms. You should be in touch with your doctor regularly. And if you start experiencing shortness of breath or any high fever spikes, you should urgently be in contact with your physician. And then they will determine what the best time is for you to seek emergency care at an emergency room or a designated hospital. Right now, hospital systems across the country are expanding their capacity. They're trying to figure out how to manage this upsurge of cases that will be coming. Another frequent question I get is like, what happens if I break my arm, or I have a heart attack, or I have other medical problems? What should I do? And I think that, again, contact your physician. Make sure that you go to a facility that is separating out the coronavirus or COVID cases from the other routine or the other kinds of medical problems that people will be facing for heart disease or diabetes or other medical problems, broken bones, lacerations, other reasons that people go to the emergency room. The hospital emergency rooms are now separating out people for different purposes. So it's really important to make sure that as this epidemic is spreading, that you can safely get essential medical services. Most states are now recommending that you postpone any kind of elective medical care or elective surgery. Elective dental services are also being recommended to be postponed. That being said, if you're sick and you have a toothache, or if you break a bone, or you need medical care, or you're dealing with another medical problem, of course you need to continue seeking care and getting the best possible care that you can during this COVID pandemic. The next question that I've been asked a lot, and this is a hard one for me to answer, is what are the best media sources that I can trust for information about the COVID virus pandemic? So again, as I was saying, with this modern world of information and communication that we're in, I think many of us are being bombarded with social media, with media sources, with print and TV and all the different kinds of information flows that are coming. It's actually really challenging to process it all. And so I rely on experts, public health and medical experts that have systems and people dedicated to reviewing and processing information to provide the best and latest guidelines, rather than making it up ad hoc or going based on an anecdotal story. I rely on experts like the Centers for Disease Control and Prevention and like the World Health Organization. So WHO.int and cdc.gov or coronavirus.gov are the three websites with the standard recommendations for guidelines. These guidelines are not always easy to read, so if you please contact me through my website, and I'm happy to help you interpret them and see how you should implement them based on your own personal circumstance. In terms of media and news sources, I personally look at both traditional news outlets like the New York Times, the Washington Post, the Hill, Politico, and I also read the Drudge Report and Fox News as a way of getting the perspectives that are coming from all kind of political perspectives as well. So I encourage you to pick a set of sources that you feel comfortable with, one that you're really comfortable with, but also pick the ones that you're not comfortable with in order to expand your perspective and understand what other people are seeing and experiencing. I think that's really important to get in touch with the full range of information that's out there. I am posting on drpaulzeitz.org and on my Facebook page, Dr. Paul Zeitz, and the kind of best articles that I'm finding. The best article about how to control the epidemic. The best article about managing the epidemic for people that are pregnant. Or the best article that we can find about how to deal with mental health challenges during this time. So please check out my Facebook page as well. I'm open right now. If there's any other questions, I'm happy to take a pause for a minute, and I'm going to drink a sip of water. And again, self-care is really important. And if you do have any questions, please post them on the chat, and I would love to respond to them now. So I'm going to take a pause for a minute and have a little water. Okay, great. So I think the next topic that I'd like to cover is what to do about all the stress and anxiety that you may be feeling. I know I certainly have been feeling a lot of stress and a lot of anxiety, and I've had to figure out what and how to manage it. And it's going to keep happening for me, I know that. And so I'm really working on how do I build out a strategy for myself to be able to manage my own stress and my anxiety. When I go into a stressful or anxious mode, I then go into a fight or flight kind of mode. And I can feel like everything is out of control. And I feel like one thing that I would recommend is that you try to stay focused on the things that you can control and recognize and acknowledge the things that you can't control. And trying to separate out those two realms, things I can control and things that I can't control. In the area of things that you can control, there's a few recommendations that have been discussed in the media and through my medical and public health and mental health provider networks that I just would like to share with you quickly right now. Since many of us are sheltering in home and working from home, for those of us that are lucky to have been able to keep our jobs during this time, it's really important to get dressed. Get up in the morning, shower, shave, or do whatever you do to get dressed as if you're preparing for your day. It is a way of feeling good and help. It's a way of managing, it's a way of implementing self-care, and it allows you to move into a day where you're willing to take action in support of yourself and for others, the work that you're doing in the world. It's also recommended that you establish a routine so that you have a period of time where you're working and a period of time where you're not working, so that you can manage your day even if you're sheltered in place in an environment that you're not used to. That can give you predictability, consistency, and structure so that your days can flow in a way that makes you calm and helps you manage worry and anxiety and stress. Another recommendation the third recommendation is to give yourself permission to worry. We're allowed to be worried right now. One of the experts that I've been learning from is recommending that you schedule a 15-minute worry time, either every hour or once during the day, or however many times during the day you need to do that, where you focus on worrying. And you actually, one idea is that you find a person to talk to about it. Another possibility is that you can get a piece of paper and write down all the things that you're worried about. I'm worried about my own health. I'm worried about my family. I'm worried about my mom. I'm worried about my friends. I'm worried about my wife who's out there seeing patients, things like that. And then get it out and dial or set up a call with a friend and share all the things that you're worried about, as a way of having permission to worry, but don't let the worry control all your waking hours, I think is the idea. The fourth idea about mental health is to focus on being social. We've been talking about social distancing. Some people are advocating for it to be called physical distancing and social solidarity. Maybe that's a better way of thinking about it, I'm not sure. But while we're physically distancing from people and keeping at least 6 feet away from every other person, even when we're going to the pharmacy or the grocery store, or if we're visiting with family, it's important to keep that social distancing. But we can increase our social connectivity and our solidarity with people. Last night I had a Zoom call with a bunch of friends from my early childhood. We've never done that before, but it was really helpful for all of us to connect during this time. My family had a Zoom call yesterday as well, where the 8 of us gathered and we connected by Zoom, and we just all were able to share what was going on for ourselves. And that was really helpful and connecting for all of us, I believe. Definitely for me. I loved being with my family and hearing what was going on for each person and support, and everyone was able to be heard, and we're all giving and receiving support to each other. The last thing that is being recommended by some experts on dealing with mental distress is around using this shelter at home or quarantine state that we're in to make commitments and make resolutions about things that you want to do in your life. You can use your time in this space for you. You can use it to take on new hobbies, new skills. I know a lot of people are doing these TikTok challenges or challenges within the family. Mindy and my wife and I are doing a Scrabble competition. We're also, people are recommending that you look for new skills, learn a language. One of my sons is learning Spanish for free on Duolingo as part of his practice during this time. I think all these things that I've been talking about for dealing with stress and anxiety, getting dressed, establishing a routine, having permission to worry, being social while you're doing physical distancing, and creating commitments around how you grow yourself during this time are all wonderful possibilities. And then even with all of that, some people might be triggered by certain things that are going on, may find this time extremely difficult, and anxiety and stress might become overwhelming. And so please seek help from your mental health professionals, from your family, from people that you trust. When you find yourself isolating or under the blanket in a panic mode, reach out and get help to deal with the anxiety and the stress that you may be feeling. Okay, so the last thing that I'm going to talk about right now is around what can you do about preventive care? How can you protect yourself during this time as we're trying to avoid getting the virus? So my wife and I are recommending that people take vitamins and eat healthy. So eat the healthiest possible food that you can. I know for me, I have been avoiding my standard comfort foods, but sometimes I break down and have some pizza or have a little ice cream. But I've been trying to eat healthy vegetables and eat healthy food as much as possible during this time. And we have been recommending vitamins, and we are taking vitamins ourselves. We're taking 1,000 milligrams of vitamin C per day, and we're taking vitamin D3, which is a 5,000 microunits of vitamin D3 every day. There are many other ways that people do immune boosting, and I will leave that to you to find those ways for you to help you boost your own immune system. I think your mental health and your spiritual health is a big part of helping to strengthen your immune system as well. So while we're looking for ways to occupy our time, practicing meditation or yoga, getting some exercise, going for a walk or a run outside, connecting with nature is another way, as long as you're social distancing with the 6 feet apart from all people that are in your proximity. Those are things that I do recommend that you do to maintain your well-being, both mental and physical. So I've been talking for about a half an hour, and I've answered about 10 questions from people. I'm going to wrap it up today, unless there's any last question that comes in through the Facebook chat. So just quickly, are there any last questions that come up? One last question. A question has come up about preventative care related to smoking, and that could be smoking of tobacco products or non-tobacco products like marijuana. So at this time, I think the medical experts that I've been consulting with are definitely recommending that to whatever extent possible, people avoid smoking either tobacco or marijuana. And that would include vaping or any other kind of dapping or whatever other method of using marijuana or tobacco products, including all the inhaled products. The reason why this is really important at this time is that you want your bronchial and lung system to be in optimal health. You want to make sure that the cilia that live in the bronchial tubes that clean out the kind of viruses and bacteria and other things that might be that you might be susceptible to are definitely working to the best of their ability. God forbid you do get sick and you do require medical care. You want to make sure that your body is as healthy as it can be as you enter in a serious illness. And also think about others. You need to be there as healthy as you can be to support your loved ones or people in your friend and your social network or your neighbors. So I think it's very important right now to take this time to optimize your own personal health. And if you do smoke either marijuana or tobacco products, maybe take a coronavirus holiday and take a break from that and experience life without smoking. So we have another question that's coming in about the real big challenge that's happening as people are finding that their loved ones, their mothers, their aunts, their uncles, their friends are in elder care environments, either nursing home or assisted facilities or elder homes. And many of those facilities around the country have locked down and blocked visitors from entering. And I think what we're hearing from a lot of people is that people are now also being locked into their rooms, and those facilities are only providing food to the rooms, so there's no socialization at mealtime either in many of those facilities. So that's creating a lot of difficulty for the people that are in those facilities, and it's creating a huge difficulty for people on the outside. So I think that it's really important for each of us to do whatever we can to reach out to people that are in these kind of situations, try to connect to them by phone or FaceTime, or try to contact the nursing station to schedule a time when you can connect with your loved one. And if you're finding that there's a complete information blockout and you're not even aware of what's going on within the facility, you have every right to contact the administrative offices of those facilities and to demand that you get access to your loved one, either by phone or by FaceTime or some other communication mechanism. This is also a really serious challenge that's happening for pregnant women who are preparing for childbirth over the next weeks. They're also going to be limited in terms of how many people they're going to be allowed to have inside the birthing centers or the hospitals where the labor and delivery wards. It's not going to be a normal process for most people. And also people that are sick with COVID, pneumonia, are also not able to see their relatives or get support. So we've seen a lot of news reports from Italy about people dying in the hospital and not having any access to their family for love and support. So for me, it's a reminder that we should be telling everyone we know and care about right now how much we love them and care for them. And we should be coming up with new ways of communicating. So I invite anyone with any ideas, both from a medical or public health or mental health perspective, to please share them with me through my website, drpaulzeitz.org. I'm trying to collect ideas and then share them as widely as I can with people that can actually make things happen. So it is a difficult time for all of us, and there's no easy answers to many of these challenges. But I'm here for you, and I'm here for my family, and I hope that you'll be there for yourself, for your family, and for your broader community. So I think I'm going to wrap up today's live chat. It's been great to connect with you. Thank you for those questions. And we'll be back tomorrow at 3 p.m. and every day this week with a live chat to answer your questions, as this unfolding emergency is something that we're all going to have to work together on and support each other. So thank you for listening, and please let others know that I'm available and happy to answer questions during the live chat or through direct contact through my website, drpaulzeitz.org. Thank you, and have a blessed day, and please stay safe and healthy during this difficult time. Peace. Bye.